I'm Shelley Sunstein with Mount Sinai Nursing Excellence, and I want to introduce you to Megan Pay. She's a registered nurse with a master's degree in nursing. She works in the intensive care unit at Mount Sinai Beth Israel, which is one of 8 Mount Sinai Health System hospitals. Welcome, Megan. It's an honor to meet you.
Hi, Shelley. Thank you so much for having me.
So I understand that before you went into nursing, you were a teacher. So what made you make the switch to nursing?
I think that teaching and nursing have a lot of similarities. Um, and I love teaching. It wasn't the teaching that really made me change careers. It was more the New York City bureaucracy and just all of the stuff that goes into teaching right now is really difficult. And I feel like with nursing, there was so many different opportunities for me to go into. In nursing, you can work in home care, you can work in a hospital, you can be a school nurse. So I just felt like there was more opportunities for me to find my path and something that I really felt passionate about.
But you were already well into your career, right? I mean, at what age did you make the switch? And when you do that, it's kind of scary. It's challenging, scary. Any kind of change is scary to people.
Yeah, I was a little bit older. I started teaching in 2003 in New York City, and I taught math to middle school kids for 2 years. And then I decided that I wanted to travel and see a little bit of the world, and so I moved to South Korea. And I
Wow.
taught English as a second language in South Korea for a year. And then after South Korea, I actually went to Europe and I spent a couple months in Germany, but teaching English in Germany didn't work out. So I wound up moving back home and trying to decide what I wanted to do. I, decided nursing might be the way for me to go. And here I am 11, almost 12 years later. And I definitely feel like I made the right choice.
And you actually took one step further in your education and got a master's degree. It was a master's degree in what?
I have a master's degree in nursing education. So it's actually combining my two careers into one. So eventually, I'm still at the bedside. I love working with patients and their families. And so I haven't moved to do education specifically, but on the unit, I do precept like almost every other new nurse that comes to our unit. I'm one of the main preceptors who orients them to the unit. So I do still get to use my teaching skills pretty much on a daily basis in the ICU.
Megan, how did you end up becoming an ICU nurse? That to me has to be the most challenging and stressful positions in the hospital system.
It can be stressful. I think anything, is what you make of it. And I think that in the ICU, people are at their most vulnerable and their families as well, not just the patients. And I think I felt like I would make my biggest impact there and be able to help people the most. When I was in nursing school, we had to do rotations into all of the different clinical areas. So, we had a rotation in maternity, a rotation in labor and delivery, med surge, ICU. And I just remember my very first day in the ICU during clinical rotations. And I just knew from that point that it was in the intensive care that I wanted to work.
What was it that day that made you, or during the rotation, that made you think this is for me?
I just think one, like I said before, being able to help people when they're at their most vulnerable, but also just the amount or the type of work that you're doing, just I feel like means more. You get more of a result, and you see kind of what you're doing to help people almost, on an immediate basis. Obviously, there can be a lot of death and a lot of negatives and a lot of struggles and stress, like you said, but I feel like in the end, we're helping people more. I feel like the amount of help that I'm giving the people is to a greater benefit for both myself and the patient, if that makes sense.
Tell us about your most rewarding day at Mount Sinai as an ICU nurse?
I have to say I saw some, they gave me examples of some of the questions that you were going to ask, and one of them was the most memorable day in Mount Sinai. And actually, it goes back to my very first day as a registered nurse on the unit. After orientation in the classroom was over, I started in a step down unit, a surgical step down unit. So one of the patients she hadn't just had a procedure. She had had the procedure a long time ago and was having lots of complications. It kept bringing her back to the hospital. And the nurse at the time who was orienting me was a travel nurse. And sometimes travel nurses these days, especially, can get a bad rap that they're like just in it for the money, or, moving around because they can't decide what they want to do. And this specific travel nurse, her name was Trisha, I will never forget her, took this patient and spent extra time with her. We brought her into the bathroom. We physically washed her hair because she couldn't actually get in the shower. She had her lean over the sink like we were at a beauty parlor, and she washed her hair. And just the difference in the patient from before getting her hair washed to then after getting her hair washed was like such a memorable experience to me. And it made me realize that this was the kind of nurse that I wanted to be. It's the little things that really make a difference for patients, like something like that. And after we showered her, we asked for permission if we could take her outside to get some fresh air. And the doctor said that it was okay. So on the step down unit, they're still monitored. So technically we couldn't take her telemetry monitor outside with us. So we got permission and we put her in a wheelchair, and it was a beautiful day in New York City. And we sat outside for maybe 5 minutes, but again, it just changed the patient's mindset. And from the time we walked in there in the morning till later in that afternoon, she was like a different person.
Tell me, Megan, about your typical day. Do you always work the same shift, or does it vary? And just fill us in on what it's like to be an ICU nurse on a day-to-day basis.
Yeah, so we work a 12-hour shift
Wow.
at Mount Sinai, Israel. So we start at 7 a.m. and we work till 7 p.m. for the day shift. And then since it's 12-hour shifts, we work 3 days a week. I don't really like to do 3 days in a row. So normally, I'll do my 2 days, have a couple days off, and then go back for another 1 or 2. Some people like to get all 3 days, sometimes even 4 days in a row out of the way. But it is, like you said earlier, stressful and high paced. And so after those 2 days, I just need to come home and unwind and relax. So when we get in the morning at 7, the night shift gives us report. We get 2 patients in the ICU. Rarely it's a 1-to-1 ratio for nursing, depending on some of the procedures the patient's having. But for the most part, it's a 2-to-1 ratio. So we get report from the night shift, and then learn a little bit about our patients at the bedside with the night shift nurse, and then we get to work. So day shift is a little bit different than night shift, where we have a whole team of interdisciplinary people, including doctors and respiratory therapy, pharmacy, dietary, or nutrition. And we usually gather at each patient's bedside, and we do what's called rounds, where we talk about, the major events that happened, why the patient's in the hospital, and what the plan's going to be for the rest of the day. So.
And how much interaction in the intensive care unit? Of course, the family gets to visit. And how much interaction do you have with the family? Because you see, in my experience at Mount Sinai, that's what meant the most to me, was the care, the warmth, and it was genuine. And I just was comforted so much as a breast cancer patient at Mount Sinai. And that was the most important thing to me.
Yeah, I think that is really important when patients are in the hospital, is to involve, their families and loved ones in the care, especially at such a stressful time. You need those people who know you the best to be with you and to advocate for you. So, I mean, these past 2 years obviously have been really difficult with COVID and having visitors and not having visitors. So our visiting policy when I first started at Mount Sinai was open. So we allowed visitors, pretty much 24 hours a day, 7 days a week. Obviously in the ICU, sometimes things happen and we ask visitors to step out so we can, take care of the patient. But for the most part, we allowed people to be at the bedside whenever they wanted to be. And then with these 2 years with COVID and not having visitors in the hospital, it was a little bit more difficult, but we made some changes and brought in iPads and set up Zoom calls so that families could at least see their loved ones, whether the loved one was able to interact, depended obviously on each specific patient. But even if the patient wasn't able to interact, it helped the family because not only is the patient sick, but the family is dealing with it as well. So it's important to be able to have that connection, even if it is just over a video call.
Can you tell us about your most challenging day at Mount Sinai in the IC unit? Is there a day that stands out?
I mean, in the ICU, there are many days that can really be challenging. Let's see. I mean, just recently we had a really young patient. As you know, fentanyl has been in the news a lot recently, and over these past couple of months to year, I guess we've seen a lot of fentanyl overdose patients come into the hospital. So it's usually, I wouldn't say always, a majority of the time it's a very young patient. And just recently we had a patient who came in who overdosed on fentanyl, and his temperature reached 109 degrees Fahrenheit. Nobody in the ICU had ever seen that. And it was kind of chaotic. We all kind of had to, it wasn't my patient. I was just on the unit that day. It was someone else's patient, but there was multiple doctors at the bedside. Our nurse manager was at the bedside. Nursing aides, what we call a PCA at Mount Sinai Beth Israel, were helping out. We were taking towels and sheets and dipping them in ice water and putting them on the patient and putting fluid into the refrigerator so that we could run cold IV fluid through his veins rather than just regular IV. And so, it took a big amount of our team to bring his fever down and, try to figure out what exactly was going on with him. And I've actually been on vacation for the past week, but I did talk to one of my coworkers, and that patient actually did just recently move from the ICU to the regular floor. So, which was really nice to hear.
That's unbelievable. I never heard of a fever of 109.
None of us either, Shelley. It was very crazy. Like I said, it was very chaotic.
Wow. You mentioned in your story with the fentanyl the importance of teamwork. Can you talk about that? Because you said, that wasn't even your assignment, yet immediately, your first reaction is to step in and help.
I mean, I think in most places, teamwork makes a big deal, a big difference to how your day is going to go. And if you work in a place where people don't really have great teamwork, then it can make a stressful day that much more stressful. I think what I've seen at Beth Israel and in our unit, we are super helpful to each other, nurse to nurse, nurse to doctor, PCA to nutrition on the other side, or physical therapy. We all work together because what we're there for is to help the patient, and you can't really do that alone. And I think working as a team in all disciplines, helps patient outcomes, and it increases morale, and it keeps us all together as, a family, because pretty much that's what it is.
And that's what it is for me at Mount Sinai. It's a family. So here you are in a very high pressure situation working ICU. How do you stay calm? Do you have some sort of method? Do you meditate? What do you do? Because the way you were described to me is that, you're the essence of calmness in a stressful situation, and that
Yeah.
then you are leading the way.
I don't know. I mean, people say it all the time about me in our unit. I don't know. No, I don't meditate. I don't really have much much to say that I specifically do. I don't know. I just feel like the more stressed out you get, the more pessimistic you are. The more worried you get, then the worse the outcome is. Where if you just try to stay positive and kind of take it at, in the ICU, things are minute by minute almost. And so that's pretty much just how I live life, kind of, is, a minute by minute. I just do what I have to do and try to get by without getting, overwhelmed or stressed out. I'm not a very stressful person. If you ask any of my friends, any of my coworkers, my stress level is usually pretty much always on an even keel all the time. Very little stresses me so that I get agitated or worked up. I don't know. I guess just a personality thing. I'm not really sure. I don't have a specific answer for you as to why. I don't know if it's my upbringing, my parents, my siblings, my kids. I don't know.
Oh, speaking of that, when you were growing up, what did you want to be?
I mean, I think that most of my life I wanted to be a teacher. And actually, when I was going to college, I went to the University of Delaware to be an elementary education major. My mom kind of pushed back and she wanted me to do just maybe liberal arts. And she's like, you don't really know, you're young, you should see what's there. And I said, no, 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 I want to be a teacher. And then obviously she was right. I mean, not that my education degree has gone to waste, because education to me is never wasteful. And I mean, I don't know what changed my mind. Like I said, the New York City bureaucracy, and I think maybe teaching all over the country and not just necessarily in New York City is different now than it was, 30, 40 years ago. I mean, I grew up going to Catholic school. And so, I don't know if I had a different view of maybe what I thought teaching was going to be like coming from Catholic school and then going to teach in a public school. But then also moving to Korea. In Korea, teaching is like, a teacher is really high on the hierarchy in Korea, and they're very well respected. And so I knew after being in Korea and coming back to New York, I probably wouldn't ever go back into the classroom again. And my mom always said she thought I would make a good nurse. So I guess, again, she knew for sure what was right. Moms are always right, I guess, right?
I guess so. What attributes do you think somebody needs to be a good nurse? I mean, obviously the career path is great now for a nurse. There are so many options. There are so many jobs available, but what do people need to have within themselves to be a good nurse and enjoy their profession and get out of the profession what you have both given and gotten?
I mean, obviously, your most important attribute is to be caring. I mean, that's the biggest part of nursing. I think a lot of times right now we get bogged down with, charting on the computer and making sure everything's in line because nobody wants to get sued and nobody wants to get into trouble. Obviously, none of us want to lose our nursing license. And that sometimes we forget that, there's a patient and a family that is behind all of that charting. And so I think a big thing is to just make sure that you're getting into nursing because you care, whether it's, about, I don't know, making sure people who have heart failure are going home on the right meds and not coming back to the hospital, or if you care that, if you really love babies and you want to work in pediatrics, it's just making sure that you're really open to being able to give the kind of care that people need when they're sick, whether it be the patient or their family, or fellow nurses too sometimes need that extra care.
Is there anything you would like to impart that we haven't touched on yet?
I mean, I know one of the questions that they had asked was about new nurses and what advice I would give to them. And so I think that's kind of a big thing for me because nursing has always had a reputation where they say old nurses eat their young. And I think that's changing a lot now in society, not necessarily just at Beth Israel, but in general. And I think I'm trying to be that nurse who welcomes the new nurses and who, has the time to answer their questions. I always feel like I've been a nurse for 11 years. I learn something new probably on a daily basis at work. I never feel like I know 100% of the things 100% of the time, because nobody can. And it's okay to ask questions, and it's important to ask questions. And if you find a nurse who you don't think is going to answer that question, or it gives you an attitude, there's always a nurse that you can find who's willing to teach you and answer the question and nurture you. And I think that's the biggest thing also outside of the patient care, is to like care for the nurses. I've kind of mentioned that before too. I think that we need to work together and help each other. Again, nobody knows everything all of the time, and you can't expect anybody to. And, we're always open to learning, and I'm always open to teaching people, nurses, patients, families, new things that they may not know. And if I
Well,
don't know the answer, I never pretend like I know the answer. I say we will find out the answer together.
Well, I thank you, Megan Pace, for both joining us today, but more importantly, thanking you for your good and caring work. And for those of you who have joined us, thank you for joining us. And please follow along for more nurses' stories in our Mount Sinai Nursing Excellence series.
Thank you.